Namaskar, I am Gauri from MLB Medical College, Jhansi, and in the next 3 minutes, I'll give you a brief glimpse about what happens in the kidneys of patients with multiple myeloma. It's always difficult for us as doctors to give a patient a diagnosis of multiple myeloma. And to make things even worse, 25 to 75% of patients with multiple myeloma already have renal involvement when they first present to us, giving us a very thin margin for improvement of prognosis and higher mortality. What happens is either direct or indirect renal injury due to abnormal proteins produced by plasma cells of bone marrow. These plasma cells produce abnormal proteins called the light chain proteins, which combine with a protein in the kidney called the Tam-Horsfall proteins, forming cast. And these casts get accumulated in the distal tubule, causing rupture of tubule, which causes a direct injury. Indirect injury caused by hypercalcemia or sepsis or due to drugs like non-steroidal anti-inflammatory drugs. For the diagnosis of renal involvement in multiple myeloma, we have blood and urine investigations to check the level of these abnormal proteins, supported by renal biopsy, which confirms the diagnosis. And for the treatment of renal involvement in multiple myeloma, we have chemotherapy regimes including VAD regime, which is vincristine, andromycin, and dexamethasone, or VCMP protein, which is vincristine, cyclophosphamide, melphalan, and prednisolone. We also have novel drugs like bortezomib, thalidomide, and lenalidomide. We have renal replacement therapies, plasmapheresis or the plasma replacement therapy, high cutoff dialysis, and hematocrit stem cell transplantation, which can be autologous or allogenous. We also have renal transplant if needed. The things can go drastically wrong if complications like chronic kidney disease or sepsis or Fanconi syndromes occur. But there is a silver line in the cloud that about 80% of patients with renal involvement in multiple myeloma can recover their renal function if within 3 weeks if the concentration of light chains or the abnormal proteins is reduced by 60%. So, we hope that in future we have a test which can detect the kidney damage in multiple myeloma earlier and treatment which has a better prognosis for the patient. Thank you.